Okay, coming to psychosocial stress and mental health, what can be done? Well, what do I want to speak about very quickly? The burden of mental illness in Europe, psychosocial stress, and this is based on two, as I would, stressors. One is the corona pandemic, and the other is man-made conflicts, specifically war. And then I'd like to speak a bit about risk factors and what can we do in order to increase resilience. So what did we learn about corona? And there is a specific study, the LoRa study, which I will just show you very quickly some results. And what can we really do to do a preventive approach? And what does research tell us about this? Now, just to remind you that the number of people with mental illness is considerable. If I always say 1 out of 4 people all over the world have a mental illness diagnosis, 1 out of 10 of everyone has actually an acute illness and needs treatment. And so if we look at, beside the personal burden and the burden for the families, in addition, there are enormous economic burden in addition to that. And if you actually look at things like jobs or relationship, we know that mental illness does have an impact on your life. And in comparison to that, and as EPA president, this is one of the things I'm continuously saying, we're not spending enough money in order to understand mental illness. And I think that politics need to do something about this. Not only regard mental illness as an important position, but regard it as a field where investments are needed. Now, what are really stressors which impact on people with mental illness? Well, one is the COVID-19 pandemic, which I will speak about in a minute, and the second is the war. And I think that the underlying problems are they're facing the increased demand for psychiatric services. They are at the edge. We need to adapt, we need to change. And I think if there's anything good about these crises, we need to get things done, and we need to get them done better than we did it in the past. And beside all of that, crying for resources is not very helpful because they are limited. So we need to use the resources better. So just a short summary about what I think are the facts for mental health and the pandemias is that if we actually look at the development of illnesses, and you can see in this graph down here, here you see the so males and females, and here you see the sort of depression and anxiety disorder, and you can see the increase. Wait a sec, this is the right, yeah, that's the right thing. So you see actually during COVID-19 pandemic, you see a significant increase, and that is true for anxiety disorders, which is A, and that is true for depression. So obviously things associated with, let's say, stress means that diseases are increasing. And if you actually look at the global burden of major depressive disorders and anxiety, then you see a change with the pandemic. So it's not a myth, but it's a fact that we have about 15–20% of more people developing anxiety disorder and depression worldwide. And if you actually look at the map where that is most pronounced, you can see percentage change in the prevalence, and the darker you are, the worse it is. It is easy to say that those countries where you have either no people living or reduced a number, or you have possibilities like in some parts of Europe to protect yourself, that means that you can reduce the likeliness to have actually a change in prevalence. So indeed, these pandemias, they do impact us. That is once more the change in percent. And again, there is a shortage of resources in general, I think, and that is something we need to take in account. And, advocating for mental illness, I think it's always important to say, no, there are not enough resources for mental illness. So that is one thing. It's the COVID pandemic, and I think there is a lot we can learn from that. And I will show you very briefly from, let's say, research, which is actually done partially in our department, in order to understand what can we do better if pandemias of this kind do hit human mankind, because I don't think that this was an exception. I mean, you could have this idea, this happens all 100 years, but I think globalization and things like that will actually force us to think about these things in a sort of shorter period of time. But there is other, let's say, man-made catastrophes, which is war. And if we actually, again, look at the sort of the facts, so what does actually war does? And if we actually look, as you can see on the left-hand side, there is a long list, and you see some of the wars, Croatia, Kosovo, Serbia, and so forth. And you can see, if you look at post-traumatic stress disorder, the increased prevalence, which is clearly seen and suggested by all of the studies. And if you look at the right-hand side, again, you can see, looking at major depression, again, you see Croatia, Kosovo, Serbia, Bosnia. These are all published by Stefan Priebe from London. So you can see there is no question, war causes mental health problems. And I think it's always important to show people, because sometimes you have the impression, oh, look, I mean, you have wounds, you have infections and other things, but people are okay with mental health. They are not. Mental health is impacted by war significantly. And the question is, what can we do about this? And this is what I'd like to show you in with a few slides. But as a matter of fact, they are psychological and pharmacological interventions which we actually know and how to adapt. So starting with the psychological interventions, this is just on the left-hand side, an overview showing a large quantity of studies showing that actually doing psychosocial interventions favors the intervention. And if you look at the right-hand side, which is more like looking into methods, mindfulness, EMDR, and specific CBT is actually significantly helpful. So it's not true that we can't do a thing. So we have measures, and we can implement measures in order to help people who are traumatized by the war. Question medication. Well, I'm on one of those 40 years of psychosocial, of medical model, but trying to learn and improve. But as a matter of fact, even antipsychotics will help you. And drugs like prazosin, which is an alpha receptor blocker, which actually helps to reduce the nightmares and helps to reduce anxiety. So I think we have measures not only to diagnose, but in addition to that, actually treat these conditions. So be active, identify people, and then give them adequate help. If we then say, well, what do we really do? And there is a nice meta-analysis which actually then looked at how do we combine and what are the best combinations. And obviously, if you look down there, you can see that support is important, and as you can see, psychoeducation and other measures which actually are easy to deliver. So it's not something where you have to say, oh, I will ask a psychologist, he will come next week. No, you can start right away by building up a group and actually doing something to the people. And I will show you what EPA has done, very simple things in order to reduce the burden actually catastrophes impress on people. So what about risk factors and resilience? Can we understand some of that? And this is the LoRa study, which I sort of promised you to show. Well, what is it about? It was an ongoing study of healthy population 2,500 people. That is people from Mainz who have done that. And then they didn't plan that, but then COVID stroked them. And then they could actually see what happens to people, to healthy people, if you then actually go into lockdown. Well, the good news is that 84% of the people, they even reduce their stress level. So here you have the stress level on the left. And here you see down the greens. So they were okay. So it's the majority. So it's, again, this is something we need to say. Not everyone gets something. The majority stays fine. But here we have, as you can see, a vulnerable group. These are the adaptives, 8.3%. So they're getting worse with their stress. So pre-lockdown, then week 3 and 4, but then they recover. So their resilience can sort of push up and cope with the situation. But as a matter of fact, we then left with the vulnerable group. This is about 8%, and that is quite, what we know from new incidences of illnesses like depression and anxiety disorder. They're roughly 8 to 10% on a yearly basis. So that means these are people who don't have the resilience in order to cope with this situation. Now, the question is, whom do we treat, and how can we recognize this group of the vulnerable people at an early stage? So not at a stage where they are depressed, where they are suicidal and need inpatient treatment. So what can we do at an early stage? And this is using mathematics. It's machine learning. So very simple. This is a study which is actually mainly done by Dr. Adorian. She is my deputy, or she's the deputy of our department. And so she is actually coordinating all the COVID work in our department. And what they did quite nicely, they have looked for psychosocial determinants. And then you can see blue, they were the ones who obviously were fine. So they were coping fine. But as you can see, there is a group of the red ones who obviously had sort of bigger problems with coping with the stress. Well, you had some guys misclassified, but what they tried is then, why don't we then build up a model of several steps where you could say, well, that is people at the R1, which, they have a low stress response in a way from have less problems, but possibly they need some sort of relaxation and some feedback from a smartphone-based mindfulness exercise. Then there is a little group and they need a telephone consultation, and there is a very small group who need an outpatient preventive. Now, what they currently do in a prospective manner, try to see whether that is working in an online fashion. So people can actually, in our hospital, there are 10,000 people working. If they have problems, they can actually link up, and then based on this algorithm, they are then categorized. What kind of help do you actually possibly need? And then you can choose yourself whether you think this is sufficient. So the idea is based on very simple, let's say, your own feelings, your own anxiety, and so forth. Find the most appropriate help within a short period of time. Now, this is a bit biology, but I think, sorry for that, but I think it's important to sort of take into account that actually the stress system is something which is quite well operating. And if there is problems at certain levels, that will lead to stress-induced disorders, and they are very likely let's say, depression and anxiety disorder. And I just like to show you that there is a quite fine feed forward. As you can see, we have stimulative pathways. You know that? If you have nice food or something, so it stimulates, or you have problems, again, it stimulates, and then we have a feedback from the adrenal gland to the CSF. And so if you have a problem in this feedback loop, this is the hypothesis at least, and I think there is some good evidence for that, then diseases like depression and anxiety disorder will develop. So very simple for the last few minutes, because I promised to have 10 minutes for talk, for discussion, if you want to. What did EPA do, really, to when facing the war, in order to give simple help to people facing the traumatization of the war? Well, the first is knowledge. Sort of gathering knowledge about trauma. We called that EPA Trauma Research Center. So what we did was actually, you can link up with EPA and you will find videos and e-learning modules of different kinds. As you can see, there is a lot from the Royal College. That's the first page, but we have done more. So you can actually access free psychosocial support, and this is given in different sort of languages. So we are continuously uploading this page. So if you think it would be helpful for anyone to have a link or have some literature or have, let's say, a web-based information, send it to us. And we are approached quite well. And the third is So that was the free psychosocial support. And again, we have ample literature. So you can, even new papers are uploaded, and I'm thankful to the team at the EPA central office who continuously screen, and if they get something, to push that up. So knowledge. The second is help the helpers. Because we found out that actually, if you have something like that, it's very unreasonable to think that professionals have enough time and space to help all the people. So as a matter of fact, you will help your traumatized neighbor. You will help your traumatized family member. You will help your friend. But how do you do this? And what does it mean for you if you actually deal with people who are traumatized? And that was the basis for that. Help the helpers. And we developed a webinar. And the good thing about that, we've actually included people who have had, as professionals, experience with war. It's not me. I had none. But it was actually Natalia Maruta from Ukraine herself. And then we had Martina Rojnić-Kuzman from Croatia, and a third colleague again from Ukraine. And the idea was, what can you as a professional who has experienced war, what can you tell actually lay public how to deal with trauma? And we did a webinar, and you can still access this with sort of three topics. So first of all, the introduction and practical tips. And then Natalia did one with a focus on children. So what you do if you experience traumatized children. So what is the right way to do? And then we had the third one, and that I liked in a way very much, because it openly said, if you deal with traumatized people, mind, because possibly you're traumatized yourself, because it's a lot of stress. So it's not only burnout, but it's traumatization. And how do you deal with that? And I have to say that doing these little videos, I think that was a lot of, we had a lot of interactions and discussed a lot. And I have to say, I learned, I think, out of this group, possibly most from all the colleagues. And the last thing is, because that was when the war started, a week after the initiation of the war, I initiated a then weekly Zoom with the colleagues from Ukraine and the neighboring countries, presidents or representatives of the psychiatric associations. And my question to the round is, what can we do for you? So is there anything we can do for you in order to make that situation more acceptable for you? And they said, yes, we need information, so we've done that. The second was we need information about how to really help people, the lay public. And the third is we need medications. So what we did, and that's the final point, we tried to actually put together money we collected, we bought medication, and now I think the fifth transport is on its way, sending medication to hospitals. They send us the lists, what they need, and we try to buy that and actually deliver. So this is the summary. So apart from our cognitive skills, our stress resistance enables us to adjust to coping with the changing world and its stress factors. Chronic, enduring stress, where human beings cannot escape, is very burdensome to them. To increase resilience and reduce risk factors, one needs to reduce acute stress, comfort and inform, and treat and handle the long-term consequences like depression, anxiety, and post-traumatic stress. Therefore, I think that professional help and protect the helpers are possible ways to tackle that. Thank you very much, and I'm happy to answer.